Welcome to today's video lecture on celiac disease. Before we start, don't forget to check out our website madeformedical.com for hundreds of more videos like this at the end of this video. The link is in the description. Today, we will dive into an important topic in gastroenterology, celiac disease. This chronic autoimmune condition affects many individuals worldwide and requires proper understanding for accurate diagnosis and effective management. By the end of this lecture, you will have a comprehensive understanding of the pathophysiology, clinical presentation, diagnosis, and management of celiac disease. Let's get started. Celiac disease, also known as celiac disease, is a chronic autoimmune disorder characterized by a permanent intolerance to gluten, a protein found in wheat, barley, rye, and certain other grains. It primarily affects the small intestine, but can also have systemic manifestations and affect various organ systems. In individuals with celiac disease, the ingestion of gluten triggers an immune response that leads to damage to the lining of the small intestine. This damage occurs due to an immune-mediated reaction primarily involving T lymphocytes, resulting in inflammation, villous atrophy, and crypt hyperplasia in the intestinal mucosa. The exact underlying cause of celiac disease is not fully understood, but it is believed to involve a complex interaction between genetic, environmental, and immunological factors. The pathophysiology of celiac disease involves a complex interplay between genetic, environmental, and immunological factors. Human leukocyte antigen, HLA, genes, specifically HLA-DQ2 and HLA-DQ8, play a significant role in the development of celiac disease. Over 90% of individuals with celiac disease carry the HLA-DQ2 allele, while most of the remaining individuals carry the HLA-DQ8 allele. These genetic factors contribute to the susceptibility to develop an abnormal immune response to gluten. The ingestion of gluten-containing foods acts as the environmental trigger for the development of celiac disease. Gluten proteins are resistant to complete digestion in the small intestine, leading to the formation of gliadin peptides that can activate the immune system. In individuals with celiac disease, the immune system mounts an abnormal immune response to gluten. This response involves both innate and adaptive immunity. Normally, gluten is made up of multiple gliadin peptides, and the body deaminates the gliadin. They are deaminated by the enzyme tissue transglutaminase, leading to the formation of deaminated gliadin peptides, also called DGP. These DGP peptides have a higher affinity for HLA-DQ2 or HLA-DQ8 molecules. Dendritic cells in the intestinal mucosa present the deaminated gliadin peptides to CD4 T lymphocytes, which recognize them as a foreign offender, hence stimulating an inflammatory cascade. This interaction triggers an inflammatory response involving the activation of T cells, production of pro-inflammatory cytokines, such as interleukin-15 and interferon gamma, and recruitment of other immune cells to the site. The activated immune cells, particularly intraepithelial lymphocytes, infiltrate the epithelium of the small intestine, leading to damage to the intestinal villi and the characteristic histological changes observed in celiac disease. The chronic immune response and inflammation in celiac disease lead to structural changes in the small intestine. The intestinal villi become blunted and flattened, resulting in decreased surface area for nutrient absorption. Crypt hyperplasia occurs with an increased number of crypts, reflecting an attempt by the intestine to regenerate damaged tissue. Celiac disease can present with a wide range of clinical manifestations. The clinical presentation can vary among individuals and may differ depending on age, disease duration, and the presence of associated complications. Recognizing the diverse clinical features of celiac disease is essential for timely diagnosis and appropriate management. The following are the common clinical presentations of celiac disease. Gastrointestinal symptoms are common in celiac disease and can vary in severity and presentation. Here are the gastrointestinal symptoms commonly associated with celiac disease. Chronic or recurrent episodes of loose or watery stools are a hallmark symptom of celiac disease. Diarrhea may be persistent or intermittent. Many individuals with celiac disease experience abdominal pain, which is often described as crampy or colicky in nature. The pain may be present throughout the abdomen or localized to specific areas. Excessive gas and bloating are common complaints in celiac disease. The bloating can cause discomfort and distension of the abdomen. Celiac disease can lead to malabsorption of fats, resulting in the passage of bulky, pale, and foul-smelling stools. This condition is known as steatorrhea. Some individuals with celiac disease may experience episodes of nausea and vomiting, especially after consuming gluten-containing foods. While diarrhea is more commonly associated with celiac disease, some individuals may experience constipation. It is less common but can occur. Nutritional deficiencies and growth issues are very common in people with celiac disease, and it can result in poor weight gain, stunted growth, and delayed development. Unintentional weight loss despite adequate caloric intake. Impaired linear growth in children resulting in short stature. The most common dermatological manifestation of celiac disease is dermatitis herpetiformis. It is a chronic, intensely itchy skin rash characterized by grouped vesicles, papules, and excoriations. Typically affects extensor surfaces, such as elbows, knees, buttocks, and scalp. It is closely associated with celiac disease. Other manifestations of celiac disease include iron deficiency anemia, osteoporosis, peripheral neuropathy, migraine, delayed menarche or amenorrhea, and effuse ulcers. The diagnosis of celiac disease involves a combination of clinical assessment, serological tests, and confirmatory procedures. The following steps are typically followed in diagnosing celiac disease. Medical history and physical examination. Begin by taking a detailed medical history from the patient. Take a detailed medical history to identify symptoms and risk factors associated with celiac disease, such as gastrointestinal symptoms, nutritional deficiencies, family history of celiac disease, and associated autoimmune conditions. Perform a thorough physical examination, focusing on the abdomen. Palpate the abdomen to identify areas of tenderness. Assess for rebound tenderness, guarding, and signs of abdominal distension. Also assess for signs of malnutrition, growth issues, dermatological manifestations, and other systemic abnormalities. Serological tests are the first step in screening for celiac disease. The most commonly used tests measure specific antibodies in the blood that are associated with celiac disease. Immunoglobulin, or IgA, anti-tissue transglutaminase antibodies. This test has high sensitivity and specificity for celiac disease. IgA anti-endomysial antibodies. EMA testing is highly specific but may have slightly lower sensitivity compared to TTG antibodies. IgA anti-demydated gliadin peptide antibodies, DGP antibodies, are highly sensitive and specific, particularly in children. Celiac disease is strongly associated with specific human leukocyte antigen, HLA, genes, primarily HLA-DQ2 and HLA-DQ8. Genetic testing can help exclude celiac disease in individuals who do not carry these genetic markers. It is important to note that HLA typing alone cannot confirm the diagnosis, as these genetic markers are also found in a significant portion of the general population who do not have celiac disease. In cases where serological tests and biopsies are inconclusive or not feasible, a trial of a strict gluten-free diet can be considered. Improvement in symptoms, normalization of serological markers, and histological recovery on follow-up biopsy after adherence to a gluten-free diet can support the diagnosis of celiac disease. The primary treatment for celiac disease is a lifelong strict gluten-free diet. Gluten is a protein found in wheat, barley, rye, and related grains, and it triggers an immune response in individuals with celiac disease. The goal of treatment is to eliminate gluten from the diet to alleviate symptoms, promote intestinal healing, and prevent complications. Provide comprehensive education to the patient about celiac disease, gluten-containing foods to avoid, and strategies for maintaining a gluten-free lifestyle. Refer patients to a registered dietitian experienced in celiac disease management to guide them in meal planning, label reading, and making appropriate dietary choices. Instruct the patient to strictly avoid all sources of gluten, including wheat, barley, rye, and their derivatives. Encourage the consumption of naturally gluten-free foods such as fruits, vegetables, legumes, lean meats, fish, dairy products, and gluten-free grains like rice, corn, and quinoa. Emphasize the importance of reading food labels and identifying hidden sources of gluten in processed foods, medications, and non-food products. Advise against cross-contamination by using separate cooking utensils, avoiding shared toasters, and ensuring gluten-free food preparation. Address and correct any existing nutritional deficiencies, such as iron, folate, vitamin B12, vitamin D, and calcium. In some cases, the patient may require vitamin and mineral supplementation to ensure optimal nutrient levels. Provide ongoing support, counseling, and resources to help patients manage the challenges of living with celiac disease. Encourage patients to join support groups or connect with celiac disease communities for additional guidance and emotional support. In conclusion, understanding the clinical presentation, diagnostic evaluation, and treatment options for celiac disease is very essential. By diagnosing and managing celiac disease effectively, we can improve the quality of life for our patients. And that brings us to the end of our today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up, and don't forget to sign up for a premium membership on our website madeformedical.com for more content like this.